Know of someone who has experienced a medical error. Possibly this person developed a preventable infection, experienced a surgical error, or was affected negatively by poor communication between healthcare providers. Dennis Quaid, an American actor, was affected by a medical error when his twins were given a lethal dose of the wrong medication. At Cedars-Sinai Hospital in Los Angeles, infant twins Zoe Grace and Thomas Boone were being treated for a staph infection shortly after their birth. The infants were due for a pediatric dose of Heplock concentrated at 10 units per milliliter to prevent blood clots, but were instead given a dosage from a vial containing heparin at a concentration of 10,000 units per milliliter, which is an adult dosage. Not only did this error occur once, it actually occurred again 8 hours later when the twins were given a second dose of the highly concentrated heparin.
They were supposed to have been given a pediatric blood thinner called Heplock to flush out their IV lines and prevent blood clots, but instead they had been given 2 doses of heparin, the adult version of the drug, which is 1,000 times stronger.
We all have this inherent thing that we trust doctors and nurses that they know what they're doing, but this mistake occurred right under our noses, that the nurse didn't bother to look at the dosage on the bottle. It was 10 units that our kids are supposed to get. They got 10,000, and what it did is it basically turned their blood to the consistency of water, where they had a complete inability to clot. And they were basically bleeding out at that point. There was blood oozing out of little blood draws on their feet and things like that, you know, through Band-Aids.
And that's what first alerted the nurse that there was a problem.
Right.
But the hospital never called the Quaids, and they didn't find out that anything was wrong until they showed up at the hospital early the next morning and went to the twins' room.
We were met at the door by our pediatrician, the nurse, head nurse that was on duty.
Risk management.
And risk management.
Risk management?
Risk management, which is basically the liability division of a hospital, which is lawyers.
Inside the room, the Quaids found their babies bruised and bleeding from all the puncture wounds where blood had been drawn or where they'd received injections.
They were working on Boone, whose belly button would not stop bleeding. And while they were trying to clamp it, blood squirted across the room about 6 feet and landed on the wall. There was blood everywhere.
They weren't just given one massive overdose, they were given 2 massive overdoses.
2 massive overdoses, 1,000 times what they should have over an 8-hour period that we know of.
How serious was the situation?
It was a life and death situation.
And all of it because of mistakes?
Yeah, it was avoidable, completely avoidable.
The twins were admitted to the hospital due to a staph infection, which is caused by Staphylococcus bacteria and can be commonly found on the skin of healthy individuals. Most of the time, these bacteria cause no problem. However, in the case of the Quaid twins, a staph infection was the reason for their initial hospitalization. Staph was first detected as a bump near the belly button on one of the twins, and soon after this detection, the other twins started getting sick as well. Staph is often transmitted through skin-to-skin contact, and although it is unknown how the Quaid twins acquired the infection in the first place, most often children can acquire staph from their caregivers through tiny lesions on the infant's skin, which in the Quaid's case possibly caused the infection. Or it could have been contracted during childbirth. Such infections are treated with oral antibiotics, or in more serious cases, they can be treated with IV antibiotics. While the twins were in the hospital receiving IV antibiotic treatments for their staph infection, their IV lines were getting regularly flushed with Heplock, an anticoagulant that is used to flush out IVs when they are not being used in order to prevent further complications such as a blood clot from forming. Due to a break in the system, the twins were given not just 1, but 2 mega overdoses of heparin, which, like Heplock, is also an anticoagulant used to prevent blood clots from forming in the vessels. However, a single dose of heparin is 1,000 times stronger than a single dose of Heplock. Overdoses of heparin can cause life-threatening complications like bleeding, and in the twins, this caused their blood to turn to the consistency of water, and they were bleeding out from all the places they had previously been stuck with needles throughout their hospitalization. This potentially fatal medical error was caused by a breakdown in the system and not following the correct protocol for medical administration. Correct protocol involves the 5 patient rights: right patient, right drug, right route, right dose, and right time. Healthcare providers cannot rely simply on the color of the label or the medication or the drawer it came from. The bottom line is you have to read the label and make sure you have the right drug before administering it to patients in order to prevent medical errors from happening in the future.
On the morning of November 8th, oh, did we ever figure out if it was November?
Yeah.
It is November? Okay.
Yeah.
All right, we just keep going. On the morning of November 18th, 2 pharmacy technicians brought the heparin medication at a concentration of 10,000 units per milliliter to the incorrect unit. The medication check performed by the technicians did not stop this incident. The medication later passed by the nurses who did not perform proficient medication checks and rights on 2 separate occasions within 8 hours. The nurse who spoke with Mr. Quaid on the phone approximately 9 p.m. on November 18th updated the father and mother that everything was fine, even though the children had just received the incorrect medication and dosage. The infant patients were bleeding from the overdose, and the parents were not informed of the emergency until the next morning.
Best practice in preventing medication administration errors. There are many evidence-based approaches to ensuring that a medication is not filled or administered incorrectly. Standardization and simplification are the first indication for best practice in preventing medication administration errors. Hospitals should provide unit dosing and patient-specific doses when necessary, manage drug formulations and preparations, and avoid dangerous abbreviations and dose expressions. Limited access. The limited access of certain formulas and medications reduces the risk of error. Making sure that high-risk medications are never kept in the cabinet on a nursing floor, and the control of and formulary management by the pharmacy ensures that certain medications are only stocked at specific doses and not where they can be taken advantage of. Examples of this include warfarin and high-dose narcotics such as morphine and hydromorphone. In addition, segregating pediatric from adult medications and separating look-alike drug names and packaging ensures patient safety. Storage of multi-dose vials should also be limited or reduced. High-alert medications like heparin should be limited in their quantity and number of concentration to prevent filling errors. Screen should be integrated into electronic charting, which assures correct use. High-alert medications like heparin should be limited in their quantity and number of concentrations to prevent filling errors. Screen prompts should be integrated into electronic charting, which assure correct use, and fail-safes should be integrated using barcodes during the selection of inventory at the pharmacy, validating the cabinet fill as it goes to the floor, and upon drug removal and preparation for administration by the nurse. Window lockouts in the electronic filing system should have lockouts for safe delivery times.
The Canadian Medication Administration has benefits in both the assessment phase and the evaluation phase that the American administration rights do not have. The Canadian system makes the nurse check the reason for their medication as part of their rights. This will help to prevent complications that may occur if you give a patient a medication that they do not need. For example, a patient with a normal potassium who receives an additional potassium supplement can lead to potentially fatal cardiac complications. The Canadian system also has rights that benefit evaluation, which the American system does not have. Right documentation can prevent the patient from receiving the medication too frequently or not frequently enough. An example where the benefits of this are very evident is opioid pain medication administration. If the patient receives the medication too frequently, it can lead to respiratory depression and potentially death. If the patient does not receive the medication frequently enough, then their pain will be poorly controlled and can lead to longer healing times. Finally, the documentation of the response is a crucial part of medication administration. Due to the fact that many medications have potential adverse effects, it is very important to monitor the patient so that the healthcare team can evaluate the effectiveness of the medication. and whether or not the risks outweigh the reward. One of the similarities in our systems is that nurses in both countries prepare medications only for their clients. They do not prepare the medications and then give them to another nurse to administer. The difference comes in how the medication checks are performed. The Canadian healthcare system has protocol in place to ensure that all of these rights are being followed by having two separate nurses perform medication checks on the same patient. The most important part of the system is that the two nurses cannot communicate with one another about their medication checks so that they have no outside information interfering with their evaluation. This is not a system that is currently in place in the United States and would help our healthcare system catch errors. Another similarity is that nurses in both systems must have knowledge of the medications so that they can scrutinize any order from the healthcare provider that may not be beneficial to the patient. The difference comes in that this is not one of the rights of medication administration in the United States, and it is a right in the Canadian healthcare system. With the additional measures in place in the Canadian healthcare system, Dennis Quaid's children may have received the correct amount of medication and wouldn't have had the adverse side effects.
There are many things that could have been done to prevent this terrible tragedy from happening to the Quaid family. One of the big concerns that is very problematic to our healthcare society is the fact that the nurse was being really careless and misread the label to the heparin and Heplock bottle. Because the Heplock and heparin bottles are so similar, and the nurse was in a hurry, she picked up the heparin bottle without even reading the label closely, assuming it was the Heplock when in fact it was the heparin. One of the things identified in this case that could have led to this error was how the manufacturers originally designed the labels for heparin and Heplock. The original bottles of heparin and Heplock came in identical shapes and sizes. The only true distinguishing factor is that they came in a different shade of blue. After multiple cases began popping up around the U.S. regarding the confusion between these two specific bottles, Baxter International, the place where the heparin bottles were originally manufactured, decided to redesign the label. The new heparin bottle came with a peel-off label that was gray and red to stop the confusion. This newly designed label was very different from Heplock. The one thing that Baxter International did not do was recall all of the heparin bottles that were originally sitting in hospitals, including the hospital that the twins were at in Los Angeles, California. Hopefully, with these newly innovative label designs, future mistakes can be minimized when it comes to grabbing the right vial of medicine by doctors and nurses. Another thing that has now been implemented into our system is using the barcode scanner to scan the patient and the vial, in order to make sure that it is the right patient and the right drug being given. By using this updated technology source, it is helping to reduce the negligent errors in medicine from continuing to happen.
Medication errors have been happening with nurses all around the world for years. Many errors come from lack of knowledge about the medications given. To solve this problem, nursing students are required to take pharmacology classes, since medication administration is such an important part of nursing. Although this problem has still not resolved fully, many medication errors are still occurring. What are some of the top reasons for this? Nurses who responded to a 2008 medication safety survey reported fatigue, stress, and understaffing increase the risk of making a medication error. Fatigue and sleep deprivation are linked to decreases in vigilance, memory, information processing, reaction time, and decision making. Many nurses stay up for 18 hours at a time when working 12 to 16-hour shifts, only to go back and work another shift the next morning. These nurses are at higher risk of having medication errors. The best response to solve this would be hiring more nurses, but that's not always the realistic answer. There will always be a need for nurses in society. Nurses, doctors, and pharmacists can all work together to make sure the medication is safe for the patient. Pharmacists in the clinical setting can help control and assure the right medication that the doctor prescribed is provided and given safely. Some ways to control medication errors and the problems that can arise with them are have a specific nurse-to-patient ratio. The nurse-to-patient ratio can depend on the unit and acuity of the patients. ICU nurses can have 2 to 3 patients, while a med-surg nurse could have up to 5 patients. Don't give a single nurse all of the high acuity patients, ration them throughout the nurses. Lastly, the most effective way is to perform the 5 rights and 3 med checks. Many nurses skip this step due to loss of time. Time management is an important part of nursing. If possible, there can be a delegated med nurse for that shift to administer and document the meds in a timely and safe fashion. Nurses and healthcare professionals in general are learning from mistakes like Dennis Quaid's story and are coming up with ideas to improve medication administration and eliminating occurrences of errors.
Medication administration best practices specific to nursing include checking the 5 rights, performing 3 med checks, including 1 at the bedside, checking the compatibility of the drug, confirming correct dosing and draw by a second independent nurse, as well as barcode.